to humans, cows, goats, and sheep carry this. And then epidemic typhus is caused by Rickettsia prowazekii, and it's conveyed from person to person by the body louse or pediculosis humanus. Malaria is a parasitic protozoal infection caused by a plasmodium type, and that's spread by mosquitoes. So yeah, so this is kind of a tricky question. This is something that you guys can read more about. Number 40, which of the following statements is true regarding bacterial spores? A, they're resistant to antibiotics. B, they allow the bacteria to multiply in adverse conditions. C, they are usually formed by gram-negative bacteria. And D, they can be identified by gram stain. Okay, the answer to this question is A, they are resistant to antibiotics. So bacterial spores are resistant to antibiotics. The function of a spore is to permit the cell to survive unfavorable conditions such as extremes of temperature or moisture. So they're in the environment. Spore protects the bacteria until favorable conditions occur. So we know that Clostridium difficile is a spore-forming bacteria, and that can be in the environment. It's difficult to eliminate from the environment. Okay, so let's go on to the next one. Which organism found in food poisoning causes the most rapid onset of symptoms? A, Salmonella enteritidis, Shigella sonii, C is Staphylococcus aureus, and D is Escherichia coli. Okay, the answer to this question is Staphylococcus aureus. It causes symptoms within 1 to 6 hours of ingestion, and so the others, it feels like Salmonella, some people might want to pick that because that's a pretty quick acting bacteria as well. But I have a really nice resource the FDA put out for all foodborne bacteria, and it looks like this, and it is in this chapter folder in the Google Drive. So it has all of the foodborne illnesses, their incubation times, and the kinds of bacteria, the kinds of foods that are often associated with the infection. Number 42, the IP is teaching nurses how to assess infection risks in patients. Depletion of what cell type provides the best indication of susceptibility to most bacterial infections? A, monocyte, B, eosinophil, C, neutrophil, and D, lymphocyte. Okay, so the answer to this question is C, neutrophils, and they make up 40 to 75% of all white blood cells and are the primary defense in our bloodstream. This must be question 44. It looks like I numbered it wrong. A 14-year-old boy from rural Maryland was seen in the emergency room with fever, fatigue, chills, headache, and a large annular lesion on his left thigh, which the patient described as burning and itching. Which is the most probable vector of this child's disease? And I'm sorry if you can hear my dogs barking in the background. So pay attention to the question, some good information in the question. So rural Maryland, so the location where this infection occurs is meaningful. And then the large annular lesion is also important. So the choices are A, tick, B, mosquito, C, flea, and D, louse. Okay, so the answer to this question is A, tick. So these are symptoms consistent with Lyme disease. caused by Borrelia burgdorferi. It's widely distributed in the northeastern United States, and we know from a previous question that it's not as common in southeast United States. They're actually probably not at all present. 45, I think this is 45. I messed up the numbering, so we'll know when we get to 50, when we get to the last one. Which immune marker represents past exposure to disease? A, IgG, B, IgE, C, IgM, and D, IgA. The answer is A, IgG, and so the two immune markers that are important in infectious disease are IgM and IgG. And a good way to distinguish one from the other is the G is present once the infection, the active infection is gone, and it's the immunity that shows up, the immunity indicator that shows up after. So for those of us who have titers done for chickenpox, this is what we would find after the disease was over. It would show that we had past exposure to the disease. IgM is present in the acute phase of the infection. So it's the antibody first made in response. So the way I remembered that was I used M for making. So this was when the body is producing antibodies or making antibodies. So, oh yeah, IgA is present in an allergic response, and IgA is present in our mucous membrane. Number 45, the emergency department reports 3 cases of cramping, abdominal pain, and diarrhea within a 24-hour period. All persons are from the same community, and onset of symptoms was within 12 to 36 hours of a picnic they all attended. The IP suspects which of the following foodborne illnesses? A, Salmonella, B, hepatitis A, C, Staphylococcus aureus, and D, Clostridium perfringens. So I know you all wish you had that chart, because this is the first thing I'd be pulling out, as I'd be looking at the chart. I wouldn't be relying on this for memory, but for the test, you do have to have some of this memorized. So the answer to this question is A, Salmonella, and the onset is within 6 to 48 hours. Hepatitis A within 28 days. Staphylococcus aureus 1 to 6 hours, which we just learned. And the Clostridium perfringens is 8 to 16 hours. 46. When reviewing the gram stain of a person with a wound infection, the IP sees gram-positive organisms in clusters. Which organism would this most likely represent? Streptococcus, B, Enterococcus, C, Corynebacterium, D, Staphylococcus. Okay, the answer to this one is D, Staphylococcus. It's gram-positive cocci in clusters. Streptococcus is gram-positive cocci in pairs. Enterococcus are gram-positive cocci in pairs or short chains, and Corynebacterium is a gram-positive rod, not a cluster, not a cocci. 47. The IP receives a call from a young man who thinks he was exposed to HIV. He has just taken his first test, an enzyme-linked immunosorbent assay or ELISA, which was negative. Which of the following is the most likely time frame after exposure in which HIV antibodies would be measurable in a blood test? A, 6 months, B, 1 to 3 months, C, 12 months, and D, 7 days. Okay, the answer to this one is B, 1 to 3 months. People usually develop measurable levels of HIV antibodies within 30 days of infection. Some may take longer, up to 3 months. 48, the causative organism of Creutzfeldt Creutzfeldt-Jakob disease is A, helminth, B, a diphtheroid, C, a spirochete, and D, a prion or prion. Okay, the answer to this is prion, and prions are not bacteria, they're pathogenic proteins. And that is another hot topic on this study exam is Creutzfeldt-Jakob disease. It's really, I would advise you guys to read that chapter in the APIC text. 49, anaerobic culture should be used for any of the following sites except A, blood, B, transtracheal aspirate, C, spinal fluid, and D, sputum. And this is, remember, read the questions carefully and don't forget, notice it's an exception question. So you're looking for the one that is not, should not be cultured anaerobically. Okay, so sputum is the answer. Other specimens not suitable for anaerobic cultures include a rectal swab, a nasal or throat swab, a urethral swab, and voided urine. And the reason for this is that all these oxygen would be present in the environment where you'd be testing these materials. 50, routine microbiologic sampling is indicated for which of the following? A, respiratory therapy equipment, B, dialysis fluid, C, sterile disposable equipment, and D, operating room surfaces. Okay, this is the last question, and the answer is dialysis fluid. So I am going to close this audio or video, whatever I'm doing here. But before I do, I want to show you guys the Google Drive where all these materials can be found. So just bear with me while I pull that up. Not finding my Google Drive, that's not good. Oh, here we go. I'm just being silly here. Okay, so let me share my screen with you guys so you can see what I'm doing. All right, so I'm in the Google Drive. This is hooked up to my own personal computer, my personal email, Gmail account. So this is where we want to go for, this is where I'm going to put this recording. So this recording is going to fall in place probably January 9th, and then I have another recording I have to do, and I believe it was the first part of chapter 4 didn't record. So we'll get that up. The other materials in here are organized by chapter number in the study guide, not by APIC chapter. So in chapter 3, all of these materials can be downloaded by you guys, and you can look at, you can read some chapters if you don't have them. If you guys don't have access to the APIC text, I can help you out with that. Just email me and I can load chapters in here. But these are the ones that I read for when I studied for the test. and other folks have made recommendations, so they're all in there. The other, what we're going to start on next time, and I'm going to start up a new video and I'll go over this again, is the statistics, surveillance and epidemiologic investigation. This is generally the hardest chapter for most IPs. It's difficult to do in a webinar. The questions is math questions, and I try to walk you through the math a little bit, but it's a lot you have to kind of do on your own if it isn't an area of strength for you. In the Prevention Strategist, there are some excellent articles that I've uploaded here, and you can just read through these as you're learning about surveillance. So definitely read these. They're well worth it, actually. I enjoyed them myself. This was not an area, this is the chapter that kept me from taking the test for a really long time. I've been a person who has some math anxiety my whole life, and I was delighted to find when I actually took the test, I was pretty well prepared. So I am going to sign off here now, and I'm going to start up another one so that you'll have this recording available to you. So thank you.